There's been a lot in the news about a rare inflammatory response to COVID-19 in children, and we know that families have a lot of questions. We're joined today by Dr. Godbout, our epidemiologist, to get the latest updates on COVID-19 and kids. Thank you for joining us today, Dr. Godbout.
Thank you for having me.
So to start, can you describe a typical response that kids have to COVID-19?
So the good news is that a vast majority of children infected with COVID-19 have a mild clinical course. Children can be asymptomatic, meaning that they don't have any symptoms, or they may have mild to moderate symptoms consistent with what we normally see with an upper respiratory tract infection. These symptoms include fever, cough, runny nose, sore throat, nasal congestion, maybe body aches, and a small percentage of children can have some diarrhea. Children, in comparison to adults, are much less likely to be hospitalized and much less likely to have severe illness or complications. That being said, we do know that severe outcomes have been reported in children with COVID-19. They can get very sick, although it is not common.
Okay, so when there are these rare cases that are more severe, or a kid is having far different reactions to COVID-19 than have presented before, what's exactly happening?
So what you're probably referring to is a lot of what we've seen in the media recently about a rare inflammatory response. So there are reports of clusters of children with a rare and potentially serious inflammatory illness in Europe and in the United States. In particular, we're seeing these cases in New York, but other states have reported cases as well. So these cases are still being investigated to determine if the rare inflammatory illness is directly related to COVID-19. Some children test positive for COVID-19 at the time that they're screened for their illness, but some don't. And a large number of these children show antibodies for COVID-19, meaning that they may have been previously infected with the novel coronavirus. So doctors really across the world and also here in the US are working hard to learn more about this. This multi-system disease that we're seeing may be a post-infectious inflammatory process, so essentially a response from the immune system. So many of the symptoms that have recently been described in some of these cases resemble those of a rare childhood illness called Kawasaki disease. Kawasaki disease is a clinical diagnosis. There's no specific test or lab that we can use to detect it. It's actually been around for decades, and we've never known the etiology or the official cause of it. But we've always thought that there was an association with viruses, although we've never been able to directly prove that. So the current multi-system process that's being reported is a little bit different than what we normally see with Kawasaki disease. We have heard that the CDC is going to put out a case definition to better define the illness, so we're definitely going to be on the lookout for that. But in general, some of the reported symptoms that we've seen have included prolonged high fevers in the setting of some of the following symptoms: red eyes, rash, severe belly pain, cracked red lips, among some other things. So I think that what we're seeing is that there can be a wide range of inflammatory responses our bodies can have to different triggers, and sometimes those triggers are viruses, and I think that might be what we're seeing.
Okay, and how rare are these inflammatory responses?
So far, this really does appear to be rare. The number of reported cases worldwide has been small, although that could certainly change as health systems learn a little bit more about what to look for in specific cases. Currently in the US, the greatest number of reported cases have been in New York State. I believe they're up to 90 to 100 cases. There have been a handful of cases reported in other states, such as Louisiana, Massachusetts, Mississippi, and I believe California as well. And there's certainly been a handful of cases reported in European countries. So right now, we're learning a lot more about this process, but we do still believe that it is rare.
Okay. And how are these symptoms all treated in kids, whether it's the stomach aches or cracked lips or eyes, anything?
Yeah, so if we have concern that a patient sort of met criteria for one of these infectious processes, Treatments have included things such as supportive care, that might mean fluids or oxygen, and then medical treatments vary, and it includes medications that can have an effect on the immune system. One example is intravenous immunoglobulin, also known as IVIG. But there are other medications that can have an effect on the immune system that can sort of help dampen the body's immune response. So, some of these inflammatory processes in children, again, they existed prior to COVID-19. And so doctors all over the world and our country and locally have experience and have expertise on treating these types of things.
Okay. And this is kind of a hot topic right now. Obviously, a lot of people are avoiding going to doctor's offices or any places that could have COVID-19 floating around or patients having it, anything. So when you think that your child has COVID-19 symptoms, when is the best time to go to the ER?
So I think that there's sort of a list of things you need to look out for that you would bring your child to the emergency room regardless of them having COVID-19 or not. Some of these things include if your child is having difficulty breathing or trouble breathing, they're breathing very quickly. If you have an infant and they're having difficulty feeding, or you have a child that's really not drinking and able to maintain their hydration. If you have a child or an infant that's having, severe belly pain, severe diarrhea or vomiting, lethargy, irritability, or confusion, those are all reasons to definitely seek care immediately. If your child is having sort of high prolonged fever for more than 4 days, and we define fever as 100.4 or greater, I would definitely touch base with your pediatrician to discuss the case a little bit further to figure out what the next best steps are.
Okay, great. And sure, we have a bunch of resources online, and you can call us at any time if you have any questions. We have a COVID-19 hotline as well. So
yeah, I think you guys just did a really great blog post with Dr. Frank Petrozzella from the CHOR ED, who also has some guidance on what to look out for.
Yeah, so definitely just visit our website if you have any questions. Other than social distancing and staying at home, which most of us are already doing, what can we do to prevent the spread of this virus?
So it's really important to maintain all those good infection prevention strategies to really help transmission of the virus. So as a reminder, the main mode of transmission is person to person via respiratory droplets. These droplets are really thick. They don't linger in the air. Usually if someone coughs or sneezes, they can come out and they sort of will land within 3 to 6 feet. And that's why we really highly encourage social distancing. Social distancing really means to stay about 6 feet or more away from another person. So just as you mentioned, I mean, if you're in a public space, we really want to make sure you're trying to stay 6 feet away from another person. If you're not able to accomplish that, the CDC does recommend wearing cloth masks. We don't recommend cloth masks for children under the age of 2, but if you have a child that's older than 2 and you happen to be in a public setting, that may be an option for you. So social distancing, but in addition to that, we want to make sure that we're washing our hands, practicing really good hand hygiene, and also keeping all those high-touch surfaces in our house clean. And routine cleaning products in your home will kill the coronavirus.
That's good to know, and thanks for those extra tips. It's always great to be reminded. I think a lot of grocery stores now and public places are doing signs on the ground of where 6 feet is, so it's a little bit hard to remember when you're doing something as routine as running to the grocery store, but it's nice that everyone's taking caution. So is there anything else that we should know related to COVID-19?
Yeah, so I think so far this reported inflammatory syndrome that's been seen in children is rare. I know that we're seeing a lot of things on the news and in the media, and I think that that can be really scary as a parent, and it can be scary for our kids as well. I think part of the reason that we're seeing a lot of these alerts come out is really just to make people aware. You know, this thing is rare, but it can be serious. So it's sort of a way to let people know what to look out for, essentially. But, you know, again, a vast majority of children do have a more mild clinical course. Here at Shore, we have really been working around the clock to make sure that our ambulatory clinics and also our hospital is infection-free. We're working really hard to make sure it's a safe place for your children, for our workers, and also for our community. So we are prepared with the necessary equipment and supplies. So if we do see any children with COVID-19 come in, or any children with COVID-19 with this sort of rare inflammatory process, we are ready, and we're ready to take care of your children. So take a big deep breath, hug your babies, continue practicing good social distancing, good hand hygiene, just to sort of minimize your risk for exposure. The last thing I want to say is it's still very important for your children to receive their routine vaccinations, especially if they're under 24 months of age. That's sort of where a bulk of the vaccinations occur in that time frame. So we want to make sure we're keeping up with that so that we don't have a vaccine preventable illness on top of this COVID-19 pandemic.
Thank you for your time today and all these resources. I think it's going to be great and a huge benefit for any parents out there with questions. So again, if you have any additional questions for Dr. Godbout or about this topic, please leave them below. Also know that our website is full of resources for you on the topic of COVID-19 if you have any additional questions. Have a great day. Thank you.